So we're having a bit of a dental day today at the clinic, and I thought I'd take the opportunity to talk to you about why we do dental disease, why it's important to keep the teeth nice and clean, and what kind of signs you can look out for at home that there might be a problem, and also show you what kind of things that we do while they come in for the day. So we're starting off with Rosie, who's a little old cat that's having quite a lot of dental work done, and I'll show you what's going on inside her mouth and how we're going to fix it. With most animals with dental disease, they don't go off their food, and there's nothing really obvious about them that you would notice. Sometimes there's a big swelling, but it tends to be that's very late on in the course. So really what you're looking out for is, do they have bad breath, and is there a build-up on the teeth? So what we can see here on Rosie is we've got a really nasty build-up of this brown tartar on the teeth. And what happens then is it goes on to cause a gingivitis, which is where the gum next to the tooth becomes red and inflamed, and that's where bacteria and inflammation is crossing over into the bloodstream, and then you can get secondary problems on other organs like kidney problems or heart problems. So what we're going to do now is we're going to take all this tartar up, clean them up, and see which teeth need to come out. So now the teeth are all cleaned, we need to make a decision on which teeth need to come out. So what we're looking for is are the teeth loose, or do we have, like we have here, the root of the tooth exposed, where the gum was recessed, or even on this tooth here you can see it's developed a big hole in the tooth. So both these teeth now need to come out. So we'll have to drill to separate the roots and then extract those teeth. So now we're going to use these elevators to lift the tissue away from the tooth around the root so that we can wiggle that tooth out quite nice and easily without fracturing it, hopefully. Those teeth out now, not a problem. Now what we're going to do is we're going to put some polish on and polish up the teeth to give them a nice finish. Rosie's finished now, all her teeth are nice and clean. We're just going to wake her up and then move on to the next one, which is a dog. So this is Benji, and he's next up, and you can see once again he's got a build-up of this brown tartar on his teeth, and also the gums next to the tartar starting to go a dark red colour, which says that the bacteria are going into the bloodstream, and you've got inflammation there. And he also has some wobbly teeth here at the front as well that we're going to take a little look at. So we'll make a start on him now and see how we go. So we've all finished on Benji now, and you can see here his mouth is a lot cleaner and a lot healthier now we're done. He's had a couple of extractions that will heal without a problem, and we'll talk to them now about how to keep his teeth this way.